You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what I do is I talk to people, patients, family members, healthcare providers, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication, it could be chemicals at your workplace, it could be a vaccine, or it could be a medical condition. Today, we're going to be talking about maternal mental health and how important it is to address. With us to talk about this very important topic is Becky Spencer. Becky, welcome to the show.
Thanks for having me.
So can you give our audience a little bit about your background?
Sure. I've been a nurse for about 30 years, and a majority of that time I have worked in women's and children's health. I'm a lactation consultant. For about the last 15 years, I've been teaching and doing research, predominantly in breastfeeding and teaching in the nursing programs at Texas Women's University. Mental health, interestingly enough, has been just the giant elephant in my clinical practice and in my research. So about 3 years ago, I made the decision to go back and do a postmaster's program as a psychiatric mental health nurse practitioner. So now I am teaching at Texas Women's, and I'm practicing I have a perinatal mental health practice, a private practice.
So you're a doctor nurse.
I'm a doctor nurse.
And a lactation consultant. Cannot forget that. Love having LCs on the show. So again, thanks for being here. So you have a lot of experience. I know you have a practice. What are some of the common questions you get about maternal mental health?
Oh, goodness. Lots of questions, both from other healthcare providers as well as moms and birthing parents. We definitely, lots of questions about, is it okay to treat mental health conditions during pregnancy and breastfeeding? And what are the risks of treating and taking medications during pregnancy and breastfeeding, and just, is it important to treat my mental health during that time?
Wow. I understand why you get those questions, but dang, just hearing, that you do get the, hey, is it important to treat me? Because, people are so focused, and I absolutely was focused on my pregnancy, and maybe not as much on myself. So I'm glad though that people are asking. That's sort of the first step. And I'm actually going to ask you, is it okay not to treat maternal mental health? But I'm sure we will get there.
Definitely.
Okay. So when someone has a concern about their mental health and treating their mental health, what tips do you have for these folks who have these concerns about pregnancy?
I think the most important thing, first of all, is to speak up about it and to ask about it. The other important thing is to engage your support system and talk to people. I think there's so much shame and stigma and fear and concern. Fear of someone calling CPS because they don't think that you are able to be a good parent. But that shame and stigma really interferes with the need for diagnosis and treatment. So the first obstacle is really helping women and birthing parents to understand that their mental health is important, and to be a great mom, you need to take care of yourself. But it's more than self-care. It's not just, oh gosh, I just need to go out and do some more yoga. I just need to
Take
walk
a bubble
some more.
bath.
Take a bubble bath. Those things are great. Yeah. But if you're really struggling with your mental health, you need to get help.
And there's no shame in asking for help. I know it can feel shameful. That's the other thing. You've been in this space for a very long time. We hear these phrases, you have to take care of yourself, which is true, but we hear it so often. I'm not sure it always hits home the way that we want it to. So please know that we understand, and I do understand from my own experience. I don't know your experience, but I've had my own experience there, and it's like, yeah, I felt shame, but that doesn't mean me asking for help and my needing help was shameful. And, interacting with your work, that's the message that I kept getting, that there's shame and stigma around it, but asking for that is still probably going to be what's best for you.
And that's one of the hardest things in my practice is women get to me too late. Mm-hmm. They've been suffering for so long. Some women will come into my practice and they will have had their children 2 or 3 years ago and have said, I have been struggling for 2 or 3 years, and just really either didn't speak up because they were afraid to, or just really didn't even know what support was out there for them.
So thinking about these support systems that very often may start with the healthcare provider taking care of the person, taking care of the pregnancy, what are some tips that you have for healthcare providers and treating maternal mental health appropriately?
That is such a great question. I think it really starts with screening. And one of the biggest struggles that we have right now from an interprofessional standpoint of treating perinatal mental health is we have no national guidelines for screening. The American College of Obstetricians and Gynecologists initially said, gosh, we probably should be screening once prenatally and maybe once at that first postpartum visit. But Postpartum Support International, which is an organization that I just think is absolutely fabulous, they recommend a much more frequent screening schedule. So providers becoming more comfortable screening for perinatal mental health, I think, is one of the first big challenges and one of the first things that needs to be tackled. Women may need to be screened multiple times during pregnancy. Again, we go back to that shame, stigma, being fearful of saying, hey, I'm really struggling. I'm really experiencing a lot of anxiety or depression. It may take 3 or 4 or 5 times before that mother says, okay, yeah, maybe my provider does want to know about this. So offering the screening multiple times, I think, is important, and offering the screening in multiple settings. One of the most horrific outcomes, of course, is suicide from mental health conditions. And we know that is a leading preventable cause of maternal mortality in this country. So, screening really could save 2 lives, mom and the baby. So screening in multiple different settings. We know that mothers who complete suicide many times have been to an emergency room multiple times prior to that completion of suicide. So the recommendation of emergency medical providers screening, I think, anytime, at any point in time, if a mother comes into an emergency room and she's seeking care for anything in that first year postpartum, she really should be screened, because screening really can save lives.
And it's interesting that you mentioned, multiple screenings over time. And because maybe at the second or third try, the mom will say, maybe my provider wants to know about this. I think it's so important to remember that sometimes patients aren't as forthcoming because, they don't have that trust, or they're scared. They have something else. I'll tell you that, I am no stranger to this. I've definitely had some of these depression struggles during pregnancy, after pregnancy, and I have been very hesitant to say, I was like, what if they don't think I'm a good mom? Or, what if somebody else has to get involved, like CPS or 911? And not that those are negative things, but I was scared, maybe in a way that I didn't need to be, but I didn't know that I needed to be. It just goes back to this wheel of, I don't know what's going to happen. And I think you're right. I think that speaking up as difficult as it may be, is probably what's best in the long run.
Definitely. And I think once someone has screened positive, and the next most important thing that health provider can say is, this is so much more common than what you think. You are not alone. That's one of Postpartum Support International. That's part of their slogan is, you are not alone, and there is help, and you can get better. And I think that's so important. The panic of, oh gosh, what do we do now? She's having some significant anxiety and depression as a provider. Where do I go? What do I do? First of all, just tell her that it's okay. This is something that is so much more common, and we can get you help. And treatment does make a difference. So just helping allay some of those fears initially, I think is really important. And then the next thing that healthcare providers can do is to really be connected in. It takes time, but you need to know who's in your community. I have so many patients that have come into my practice that will say, gosh, you're the best kept secret. No one knows where you are. And, it's really difficult sometimes to find providers who are willing to treat patients in the perinatal period. So that's the other call to my colleagues and my peers is tap into your resources. Look and see who's out there, who's doing this work, and who can provide care to your patients.
And there's different kinds of resources. I mean, obviously this is the Mother-to-Baby podcast, and we give information about, medication exposures, but also, and certainly not just us, again, like folks like PSI, for example, Postpartum Support International, thinking about, though, the risk of untreated or undertreated mental health conditions such as depression and anxiety in pregnancy. So it's that, for us, it's always that risk-benefit analysis. And I think that a lot of providers, need to know that and need to practice that. And I know that you do, and I'd like you to speak a little bit to that risk of, untreated illness and the benefit of being well treated in pregnancy.
True. And I actually, you will hear people talk about the risk analysis, that there's a risk when you're exposed to medications or different exposures during pregnancy. But we also now know that there is a risk if you're not treated. So just anxiety and depression can cause some difficulty with your pregnancy. Higher rates of hypertension during pregnancy, higher rates of preterm birth. Those are associated with untreated or undertreated symptoms just as often, probably more often, than they are with any medications that you might take. Right. So there's that risk conversation, but you brought up the third part, which is really important, which is the benefit side. So what happens? What's the benefit of being treated? What is your, if we start medications and you start feeling better, that's an enormous benefit. It's a benefit to you, it's a benefit to your baby, it's a benefit to your family. So having that honest conversation, I think, is really important.
And I do absolutely agree with that. There are benefits to your pregnancy. There are benefits to your family. And you know what? It is okay that it's a benefit to you.
Yes.
As a person who's pregnant, let's just cut off the end of that sentence for just 1 second. You're a person. You are deserving of treatment. You deserve to feel as good as you can feel. And if it's, benefiting your family and your pregnancy, that is awesome also.
Definitely. I think it's important also to acknowledge what do we mean by treatment, right? Is it just medication? No, it's not just medication. Therapy is an incredibly important tool in treatment for perinatal mental health. I will prescribe therapy to patients. I think medications and therapy work best together. Mm-hmm. Other things like exercise and other integrative treatments, getting outside, getting exposed to light, are just as important. All of those things work together. So when we talk about treatment, we're talking about a lot, not just medication exposure.
And I appreciate that, because sometimes that's what, it's easy to think about. And some people immediately, I don't have to tell you, people shy away and say, oh, no, not medication. But just know that you're not, suggesting only medication, but that medication, can have a seat at the table when appropriate.
Definitely.
So let's talk support organizations. What is out there for people who are struggling or even are just curious about mental health and pregnancy?
So I'll go back to Postpartum Support International. That's one of the first organizations. I think it's wonderful to bookmark on your computer if you're a mom or a birthing person or a provider, because they have such a great spectrum of support materials for patients and providers. I recommend all the time the support groups that Postpartum Support International has. They have dozens of different types of support groups. And I think it's really beneficial for moms to be able to be in a group with other people and recognize that how they're feeling they're not alone. There are lots of other people out there that are having very similar experiences. And I find that to be really empowering, and also just anxiety and stress relieving in general. So Postpartum Support International is one of the first places that I will send moms to go. The Marseille Society is also wonderful. They're an organization similar to Postpartum Support International. They have great resources. And then, of course, looking in your community, doulas are wonderful, and I think are starting to finally get some of the credit and the press that they deserve.
Nice.
I highly recommend pregnant women to look into doulas in their communities and in support groups within their communities.
So, we did talk quite a bit about pregnancy, but you are a lactation consultant. So I can't let you go without making a small comment. Maternal mental health does not end when the pregnancy ends. And we know, in fact, that there are some things that can come up after pregnancy, postpartum, as we've talked about, that might be better, worse, different. And so thinking about, generally treating mental health after pregnancy, what would you say about that?
So we used to almost exclusively refer to postpartum depression, right? It was this assumption that it was something that occurred just in the postpartum period. We now kind of are moving away from that terminology, and we now talk about perinatal mood and anxiety disorders because they can occur at any time. They may start before pregnancy. They may start during pregnancy. They may start after pregnancy. So I think it's important to acknowledge that these symptoms really can occur at any time in the perinatal period, which is important. But particularly postpartum, I think that's a really difficult time for moms because you're so overwhelmed with a new baby. Many times, you're told this is supposed to be the happiest moment of your life. Maybe breastfeeding, if you've chosen to breastfeed your child, maybe it's not going so well. Yep. And it can just feel like a hole that's getting deeper and deeper and deeper to climb out of. So I think it's so important to engage your support systems before you have the baby. So one of the most important things we can do is to help moms prepare during pregnancy for what postpartum is going to look like. It sounds silly, but making a plan for where is the baby going to sleep? Where are you going to sleep? When are you going to sleep? But I think really engaging those support systems and understanding that, your job as a new mom for those first 2 to 4 weeks should solely be on you, your self-care, and caring for your baby. And the laundry, the vacuuming, the cooking meals, those things you shouldn't have to worry about. So thinking ahead of time about how can I engage my support system so that I can really prepare for this time after birth. And then having that conversation preemptively. We know we have a lot of data to kind of anticipate who might have some struggles with perinatal mood and anxiety disorders. Someone who's had depression in the past is more likely to experience perinatal mood and anxiety disorders. Someone who's had a prior experience of depression or anxiety in pregnancy or postpartum is more likely to have that again. So having those anticipatory conversations, I think, is really important so that when postpartum does hit, you have an engaged support system that might say, you know what, you seem to be struggling. Let's see if we can get you some help. And also helping the new mom or the new birth parent to understand that it's okay to ask for help, and understanding what some of those symptoms are that you might have not anticipated. I'm supposed to be so happy, but gosh, I can barely get my clothes on and get my face washed. So I think that anticipatory guidance is probably one of the most important things for that postpartum period.
And I'm so glad you mentioned, having that support system beforehand, and the idea that it's okay to ask for help and it's okay to accept help. And sometimes we get sort of caught in the middle there. So it's like, okay, should I ask for help? Someone asked, my sibling had said, what can I do for you? Siblings, other family members, friends, partners, spouses, just so you know, folks, like my wonderful, wonderful husband would say all the time, what can I do for you? Right? With the absolute best intention. The problem was my mind was mush. I didn't know what I could ask him to do. I didn't know what I needed to have done. I didn't know what would be best for him to do versus me to do. So sometimes when you're caught in that feedback loop, and again, support folks out there, just so you know, you can say, you know what? I'll do the laundry today. Is that okay? Would you like me to cook a meal for us? Can I bring some food over? Can I help you vacuum? Or can I take the baby for a bit? So it's sort of both ways. And I never thought about it like that. And when I did, I said, you know what? I'm going to tell all my pregnant friends and family, I'm not just going to blindly say, what can I do for you? I'm going to ask for something specific unless you give me something else. And, just sort of keeping that in mind, it's a partnership.
For sure. Well, and it's people understand the idea of putting a birth plan together, right? You put all this time and effort into what is this birth going to look like?
And it never does.
And it never kind of turns out the way you think it will. Yeah, you tried. But you put a lot of time and effort and energy into that. Yeah. We really need to start encouraging people to prepare for that fourth trimester and making a fourth trimester plan. And helping people to really think through a lot of those things, because it's interesting. 30, 40 years ago, pregnant women were much more sheltered. It was a time of it. You were infirm and you stayed at home, and people doted over you. And now we know pregnancy for most people is a healthy state. So yeah, you can go run a marathon. You can go do all these things while you're pregnant. But I think, please no.
I can't run a marathon now, and I'm not pregnant, folks.
No. But I think that what we've lost a little bit out of that is that protection for moms, and understanding that it is a vulnerable time, and that, and you're right, support looks like a lot of different things and can be a lot of different people. But that anticipatory guidance and planning for that fourth trimester, I think, would go a long way in helping people to understand that perinatal mood and anxiety disorders can occur in the postpartum period, to recognize maybe what some of the signs and symptoms might be, and who can I rely on if I'm struggling.
Becky, this was amazing. Thank you so much for being on the show. Now, I got to tell you before you go, I am going to ask you back to talk about something else if you're willing. It was so great to meet you and to help us educate the public on something really important.
Thanks for having me. This was fun.
And that's going to do it for this episode of the Mother to Baby podcast. Be sure to hit that subscribe button so that way you never miss a new episode, and you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast, or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contactus@mothertobaby.org. And Mother to Baby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847. By text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. Until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.